So now I will start with the microbiology question. So first question was, a 30-year-old fisherman in the coastal village with sudden onset of profuse watery diarrhea, described as rice water diarrhea. He is lethargic and has sunken eyes, poor skin turgor, and rapid thready pulse. There is no blood or pus in stool. Which of the following is most likely the mechanism of this diarrhea? Okay, na? So I think just hearing the word rice water, you have made the diagnosis that it is because of cholera, Vibrio cholera. So what is the mechanism of Vibrio cholera? So in cholera they have two toxin, cholera toxin A, cholera toxin B. They will bind to the GM1 receptor into the intestine. When they will bind to this, they will undergo endocytosis. Okay, na? And after endocytosis, there is formation of mediators. Okay, na? And by the process of retrograde endocytosis, they will work on to the GS receptor, and they will increase the cyclic AMP. Okay, na? So when they will have more cyclic AMP, it will activate phosphokinase A, which will stimulate CFR, which will lead to the chloride leakage from the lumen. Okay, na? So the correct mechanism is activation of adenyl cyclase via GS protein. Okay, na? So initially they will bind to the GM1 receptor, and by the retrograde endocytosis process they are causing the diarrhea by stimulating CFTR or by opening the CFTR channels. Okay, so the correct answer will be C. Destruction of enterocyte by cytotoxin, it can be because of multiple like Shigella, Salmonella. They will release cytotoxin and they will cause. What is the toxin activate? What is the bacteria or organism work by activation of guanylate cyclase? That is because of Shiga toxin in ETEC means traveler's diarrhea, and in the Bacillus cereus emetic form. And invasion of colonic mucosa, it can be done by multiple. So here the correct answer will be adenyl cyclase by the GS protein, because the question said rice water means he is having cholera. Okay, so this is the correct answer for this question. So next question is saying that 28-year-old male. So next question is saying 28-year-old male presented to the STD clinic, and what is having painful genital ulcer, which is tender, swollen inguinal lymph node. On examination, you see multiple shallow, non-indurated ulcer with irregular borders on penis, and the base of ulcer appears yellowish gray, which will bleed easily on contact or touching. Patient reports unprotected sexual intercourse with a new partner 2 weeks ago. Whenever you have done gram stain of the exudate, it shows small gram negative cocobacilli in parallel strands. Which of the following is true? Except. Okay, so I think by reading all this you need to know that this is our Haemophilus ducrei. Okay, na? So these STD ulcers are caused by Haemophilus ducrei. Even if you don't know, still you can get to the answer. So what it said? Painful genital ulcer. It has inguinal lymph node. Then they have easy to bleed, and then they are small gram negative cocobacilli. So first option is saying gram negative cocobacilli, since it is mentioned in question, so this will be correct. Second is saying painful inguinal lymphadenopathy. It is also correct. Okay. Ulcer base bleeds easily on contact. It is also correct. Did it mention painless ulcer with indurated disease? No. So the correct option or correct answer will be B. Okay, na? So this is just to check you guys that how carefully you are reading the question. If you sometimes if you will read question carefully, you will get answer within the question. So this is Haemophilus ducrei, and the parallel strands, this is called as school of fish appearance. And okay, na? So this is one question from the STD. Every year 1 or 2 question from the STD or STD kids are coming. So this is also a sexually transmitted disease. Next question, a 7-year-old child brought to dermatology clinic with multiple small dome-shaped umbilicated petule on the trunk and face. The lesions are non-tender, and have been slowly increasing in number over the past month. The child otherwise is healthy. When you have performed the biopsy, histopathological image is shown. Which of the following statement about inclusion bodies is incorrect? Okay, na? So we need to search for the incorrect option, and this image was given. So if you just know the image, then also you will get on to the answer. So first, they are found in cytoplasm of infected keratinocyte. Yes, okay, now why I will tell you. They are eosinophilic in upper, so they are eosinophilic in upper dermis and basophilic in lower dermis. So here you can see it represent viral replication center. Yes. Which is the incorrect, or which is the pathognomic for herpes simplex virus? No. If you know, these are called as Henderson-Patterson bodies. Okay, na? And they have mentioned the special type of rashes. So here you can see the rash and with umbilicated means the depend area. These rashes are called as pearl appearance, or these are the rashes which are characteristic for, both are characteristic for molluscum contagiosum. Okay, na? So they present in the cytoplasm of keratinocyte. Correct. They are eosinophilic in the upper dermis and basophilic in lower dermis. Correct. And they will present the replication center. This is also correct. So incorrect will be pathognomic for herpes simplex. So herpes simplex will not show Henderson-Patterson body. It will show cow dry A bodies. Okay, na? So it will show cow dry A bodies. So how they will present? With 3M, margination of the chromatin. Okay, na? Molding. So it will show margination, molding. All these will be the characteristic feature for cow dry A bodies seen in herpes simplex virus. So if you know, we had so many like these bodies. Okay, na? So they can be cytoplasmic, intracytoplasmic, or both. Okay. So in herpes simplex you will see intranuclear inclusion bodies which will show which are multinucleated, molding and margination, 3M feature. Okay, na? So they will be multinucleated, molding and margination of chromatin. Okay. Henderson-Patterson body is specifically you will see in cases of molluscum contagiosum, and the patient will present with these type of umbilicated rashes. Okay, so the correct answer will be D. So here answer will be D. Next, a 28-year-old nurse accidentally sustained a needle stick injury, okay, while drawing a blood from the patient with unknown HIV status. She present with occupational health clinic within 24 hours of exposure. She has no prior history of HIV infection. Her negative HIV test was 6 months ago. Which of the following most appropriate initial test detect early HIV infection? Okay, na? So here the correct answer will be HIV P24 antigen assay. Okay, na? So why not HIV RNA PCR? Okay, na? So I will give you a timeline. So HIV RNA PCR or RNA will appear within 10 days. Okay, na? P24 antigen will appear 2 to 3 weeks. Then antibodies will appear from 3 to 12 weeks. And then we will have other tests. Okay, so I can do HIV RNA PCR, but it is not the initial test or initial screening test. Okay, so this is not the initial screening test. If they will ask you which is the earliest to appear in blood, then it will be RNA. Okay, but if they will ask you which initial test, okay, na, or first practical marker for early detection, so practical marker for earlier detection will be P24. So this is the answer. Antibodies you will check by ELISA. Okay, na? So which is the most sensitive test, and if it is positive, then you will go or you will do Western blot assay, which is the confirmatory test. Okay, na? And one more test, that CD4 count. Okay, na? CD4 count you are not doing it for the treatment, but you will it is not done for the diagnosis. You will do it just to do monitoring. Okay na. So the treatment monitoring you can do by checking the CD4 count. Okay, so if they are increasing, means treatment is effective. So in this condition the correct answer will be HIV P24 antigen assay. Next is a 45-year-old male agricultural worker present to agriculture worker from a tropical region, present with slowly enlarging verrucous warty lesion on his lower leg. Lesions have been present for several months and associated with mild itching but no significant pain. He recalls a thorn prick injury to the area before lesion developed. The skin biopsy performed and KOH mount is given. So this image was given and microscopic finding is most characteristic. So if you don't know anything, if you will just see this image, you can see these bodies. Okay na. So these bodies are our copper penny bodies or medlar bodies. Okay na. So if in KOH mount you will find these bodies, these are medlar bodies. These are seen in chromoblastomycosis. Okay na. So you will see in patients who have chromoblastomycosis, where you will see broad based budding yeast. It is seen in blastomycosis. Okay na. Cigar shaped yeast cell you will see in conditions like sporothrix. Okay na. And spirules with spirules containing endospores, it is for coccidioidomycosis. So here in this case correct answer is medlar body. Here also you can see this is H&E staining and here they have multiple these bodies. These are called as copper penny bodies or medlar bodies. Okay, so this is the correct answer. Okay na. So for exam purpose you need to remember dimorphic fungi. One or the other question is coming in every exam, so you need to remember all the dimorphic and fungi, their clinical presentation, their KOH mount and their all presence, how they will appear, all those things. Next is a 38-year-old man with the history of poorly controlled diabetes and recent recovery from COVID-19. Okay, present with fever, cough, hemoptysis. He reports worsening shortness of breath and pleuritic chest pain. On examination, tachypneic, decreased breath sound, right upper lung zone. Chest X-ray show cavity lesion in right upper lobe. You have done CT, okay, and you have found a histopathological examination. Which of the following microscopic finding is characteristic for this condition? So this image was given. Okay, so this is the presentation of aspergillosis. Okay na. So this is the presentation of aspergillosis. Why I am saying, because if you will see this Gamori methamine stain 1, here you can see these are the fungi and they are present at the acute angles. Okay na. And in between they have the septa. Okay, so these are the septate and acute angle branching, which is characteristic for aspergillosis. Which is characteristic for non-septate hyphae with right angle branching, it is for mucor. Okay na. So they will be large one and they don't have any branching acute angle, so this is our mucor. So this is for the mucor and they don't have any septa, so non-septate with right angle branching will be for mucor. Broad based budding is, I just told you, blastomycosis. So here the correct answer will be septate hyphae. If they have not given me the image, then it can be confusing. Okay, but even if they have given me that it is a mucor case, then they will give me some black scar, orbit is involved, all those, then it will be mucor. Okay na. So here the correct answer will be septate hyphae. Next is, all of the following parasite can be transmitted to humans by ingestion of raw or undercooked fresh water fish except. So if you know, there are few organisms which are transmitted by raw or undercooked freshwater fish. Out of this, one is Typhlobothrium latum, another is Clonorchis opisthochis, and there is one more called as Heterochirus feces. Okay na, these are transmitted by raw or undercooked fresh water fish. Okay na, so diphlobottom is transmitted, clonorchis is transmitted, ophis is also transmitted. So correct answer will be Paragonimus. Okay na, so for Paragonimus you need to remember this is not transmitted by fish, it is transmitted by fresh water. So it is transmitted by fresh water crustaceans. Okay na, so what are crustaceans? They can be crabs, it can be transmitted by crabs, or it can transmitted by crayfish, which is not a fish. Okay na, so in their life cycle you will see one or other type of fish, but here you will see crab or crayfish. So the correct answer is Paragonimus westermani. All of the following uh, statements regarding the Chandler or Chandler index is true except. So what is Chandler index? First you need to remember. So what is the formula for this? So for formula for this one is you will multiply average x per gram multiplied by prevalence rate. Okay na, the formula is this. Why we for what organism we are checking this? So we are checking this for hookworm infestation. Okay na, okay, so if it is less than if it is less than 1 then it is sporadic. Okay na, if it is 1 to 10 then it is endemic, and if it is more than 10 then it is hyper endemicity. Okay na, and this is done to check the population. Okay na, in for the population prevalence. Okay na, so this is not done for the one individual. So now we will read the option. So first option is saying it is used to assess the endemicity of soil transmitted helminthic infection. Yes, because hookworm is element. Chandler index above 10 indicates hyper endemicity. Yes. Most commonly applied for the hookworm infestation. Yes. Direct measure of intensity of infection in individual. No, it is for a group of population because we are using prevalence rate. So that's this is the correct answer. So correct answer will be okay. So correct answer will be direct measure of intensity of infection in an individual. Okay na, so since we are not doing this for one individual, we are doing this for a whole population or whole community. That's why this is the incorrect option. So this will be the answer. Next question is related to sterilization or disinfection. So what it is asking, all of the following statement regarding autoclaving are true except. So we need to check about the autoclave. So what is autoclaving? So in autoclaving we are using temperature. So in autoclaving we are using temperature more than 100 degrees Celsius, so it will come under that. So whenever we are using temperature more than or above 100 degree, it will be autoclaving. Okay, so autoclaving we can do 121 degrees Celsius for 15 minutes, and what will be the pressure? 15 Pascal or 15 psi. This will be the for the autoclaving. But if you want to kill the prions, then you need to increase pressure for 134 degrees Celsius for 1.5 hours. So then it will kill prions also. Okay na, what will be the control? Control is Geobacillus steothermophilus. It will be the control where you are using autoclaving. So autoclaving is used for the sterilization of instruments, surgical instruments. Okay na, it is used for the aprons sterilization, it is used for the suture sterilization except one suture, that is catgut suture. Okay na, that is not sterilized by autoclaving. It is used for the media sterilization except two media is not sterilized, Livingston Johnson and Loeffler serum slope. Okay now these are not sterilized by this because they contain egg also, and sputum and all those are also sterilized by autoclaving. These two are mainly sterilized by inspissation. These are also sterilized by inspissation. Okay na, these are sterilized by these. So now we will read one by one. So first option is saying saturated steam under pressure 121 degrees Celsius for 15 minutes. Yes, okay na, because we are using steam under pressure, so that is correct. Suitable for sterilizing culture medias and surgical instrument. Yes, in general, yes, okay na, until they will not give you these options. It is preferred method for sterilizing heat level solution. I need to think. uh, it required complete air removal from the chamber for the effective sterilization. Yes, we need to remove the air, full air, otherwise there will be no not a proper there will be no proper sterilization. So I need to remove all the air from the chamber. Okay na, so this will also be the correct answer. Can I use more temperature for heat level solution which will break down at high heat? No. So then answer will be preferred method for sterilizing heat level solution. Okay na, so whatever heat level solution we are having, we will never use these higher temperature method. We will use filtration, so they will not get uh, destroyed. Okay. Also for autoclaving you need to remember it is effective against all microbes and spores, but it is not used for the heat level solution. So this is our autoclaving. You also need to read all those hot air oven, filtration, and ethylene oxide gases or plasma sterilization, UV radiation, all those chemical ones like glutaraldehyde. You need to remember all those. Okay. Next is all of the following statement regarding e-test for antibiotic sensitivity are true except. Okay, na, so we are doing antibiotic sensitivity. Okay, so for to test antibiotic sensitivity we have mainly three methods. One is e-test, one is broth diffusion, other one is disc diffusion. Okay, na, three methods we are using. So whenever we are using e-test, so this is e-test or epsilonometer. Okay na, in this we have these strips. So whenever we will put them into the culture media where we are growing the bacteria, here they will show us the concentration. Okay na, how much concentration of antibiotic is there, so we can quantify the MIC. So it will show us MIC, okay na, minimum inhibitory concentration. Okay, and also it will give us more precise MIC. It is versatile and it is very simple test. Okay na, and but it is a little bit costlier than the disc diffusion test. Okay. Next is broth diffusion. Broth dilution means we are taking sample, we are diluting we are doing serial dilution of the broth, which will also give us the MIC. Okay na, and this is the gold standard and for the precise MIC. So which is the gold standard and for the precise MIC, that is dilution one. Okay na, but it is difficult to do because it is time consuming, it is taking labor intensive, so that's why not used much. Okay na, disc diffusion, we have disc. Okay na, we will put them into the agar solution. Okay, we have antibiotic impregnated disc we will put, and then we will just see zone of inhibition. If it is present, then bacteria is sensitive to antibiotic. If it is absent, then there is no sensitivity. So you will not quantify the minimum inhibitory concentration in this, and you can use this only for the non-fastidious bacteria, not for the fastidious. Okay na, so this is less. So you cannot check MIC, and this is not a precise test. Since you are asking e-test, so now we will read. Provide quantitative measure with minimum MIC. Yes. Use plastic strip impregnated with gradient of antibiotic. Yes. It is less accurate than standard broth dilution method for determination. Okay. It is for both fastidious and non-fastidious. Yes. So correct answer in this case will be option C. Okay na, because it is not less accurate, even e-test is considered as accurate as other or broth dilution method for MIC. So it is equally accurate as broth dilution. So this will be the correct answer. So this is e-test for antibiotic sensitivity. Next is, which of the following is true about stationary phase of bacterial growth except. So if you know bacterial growth curve, okay na, so this is lag phase, this is log phase, stationary phase, and then we have decline phase. Okay, so lag, log, stationary, and decline. Okay na. So what are the characteristic of lag phase? So in lag phase there is no increase in number of bacteria. The bacteria is getting adapted, so there will be cellular adaptation. And for lag phase you need to remember that maximum size of bacteria you will achieve at the end of lag phase. Okay na. Then we have log phase. Log phase means bacteria is dividing quickly, so rapid or cell division. They will have smaller size. There will be maximum metabolic activity because of the division, and they are more susceptible for cell wall inhibitor antibiotics. Okay, and also if you want to remember, you can remember that when you will stain in this phase, you will get a uniform gram staining because most of the bacteria are viable, or even I can say all bacteria are viable. Okay, next phase is stationary phase. Stationary phase means viable bacteria are equal to non-viable bacteria. Okay, so you will not get uniform staining. Okay, and in this stage bacteria are depleting because of lack of bacteria growth is not happening because of lack of nutrients. Okay, and in this phase bacteria are producing spores. Okay na, they are producing exotoxins, and antibiotic production is there, and they are also producing bacteriocin. Okay na. So these all are the feature you will see in stationary phase. Decline phase means cell that is occurring, and in cell that is occurring, that's why there is less viable bacteria compared to the non-viable bacteria. Okay, so these are the bacterial growth curve. So now it is asking what stationary phase. So first option is saying most susceptible to antibiotic targeting cell wall synthesis. We need to think nutrient depletion and accumulation of toxic products. Yes, that's why they started dying. Secondary metabolites like antibiotics are often produced. Yes. Rate of cell division is equal to rate of cell death. Yes. Okay na. So all the last three are correct. So here the answer will be bacteria are more susceptible for this. No, it will be more susceptible when it is actively dividing. So in log phase they will be more susceptible for antibiotic which are targeting cell wall synthesis. Okay, so this is the correct answer. Next question is saying a 45-year-old woman with poorly controlled diabetes present with multiple painless erythematous nodule and ulcer on his right forearm. She reports lesions started as small papule 2 weeks after receiving cosmetic injection at a local spa. There is not warm or fluctuant the area. She is afebrile. She has completed a course of amoxicillin with no improvement. A biopsy of lesion shows granulomatous inflammation, and gel Nielsen means acid-fast bacilli are present. The culture grows rapidly at 30 degrees Celsius. What is the most likely organism? Okay na? And this is the no, in exam in paper you don't have this image, but I have added this. So these are all characteristic feature for Mycobacterium chelonae or Celone, whatever you want to call. So this is for this. So whenever we patient infected with Mycobacterium chelonae, so they are rapidly growing. Okay na, rapidly growing non-tuberculosis mycobacterium. Okay na, so these are non-tuberculous mycobacterium, rapidly growing. They mostly affect skin and soft tissues. Okay na, after procedures. Okay na, which kind of procedures? Like cosmetic injection, especially in immunocompromised patients. Okay, and they have acid fast bacilli, and they have grows at 30 degree quickly. So then answer is M. chelonae. These are the races you will see, or these are the presentation you will see in this. Why not M. tuberculosis? If you know Mycobacterium tuberculosis, classically it will cause TB, and it will affect more commonly lungs. Okay, but it can also cause extrapulmonary disease like lymph node, bone, or meninges can be involved. Skin involvement is there. and whenever it is happen, it is called as lupus vulgaris or scrofuloderma, but not as it is not present as rapid onset nodules after any procedure. Okay na? And also if you will grow them in culture, they will grow at 37 degrees Celsius and very slow grower. Okay na? So these are not the rapid grower. The Mycobacterium tuberculosis is a slow grower, okay, onto the culture, that's why it is excluded. Next is the marinum. Why it is not? Because whenever you will have Mycobacterium marinum infection, you will have any type of history of contaminated water. Okay na? Contaminated water, like patient will say that he was cleaning or she was cleaning aquarium, or maybe so, it will got after bathing into the swimming pools. Okay na? It can develop as papule and nodules in the hand and arms. Okay na? Even it has sometimes have lymphatic pattern. It grows best at 30 degrees Celsius, but the history of no water contamination is given, that's why it is not the answer. Next is nocardia. Why not nocardia? Nocardia is a gram positive, okay na, weak acid fast bacilli, okay na, and it is a branching filamentous bacterium. Most commonly it will cause pulmonary infection in immunocompromised patient, okay na, which can spread to brain and skin. Cutaneous involvement mostly occur after the trauma, but it will occur like they will have abscess or draining sinuses. So this is also not common. Okay, so the most probable answer in this condition will be M. Chelonia or Chelonia, whatever you can say it. Okay, so next is a 62-year-old man is admitted to admitted for a hip replacement. Received prophylactic cefuroxime. On 6th day of hospitalization, he has profuse watery diarrhea, crampy abdominal pain, low grade fever, white cell count is 20,000. On examination, his abdomen is distended and tensor. Colonoscopy will show you yellowish white plug onto the colonic mucosa. You have done microbiology, you have isolated the causative organism from his stool. Which of the following is the appropriate culture medium? Okay na? So for culture medium, so this case, so whenever any patient after taking antibiotics, okay na, especially cephalosporins or vancomycin, if they started having watery diarrhea, okay na, then it is mostly because of Clostridium difficile, okay na, and this condition is called as pseudomembranous enterocolitis. Since it mentioned that in colonoscopy it shows yellowish white plug into the colonic mucosa, means it is pseudomembrane. So in colon when you will do colonoscopy, you will find this membrane present onto the colon, so it is pseudomembranous enterocolitis. So what is the culture media for this one? So we are using CCFA. Okay na? So CCFA means cycloserine, cefoxitin, fructose agar. This is the classic selective media for isolating Clostridium difficile. It contains cycloserine, cefoxitin, which will inhibit most of the gut flora, and fructose as a fermentable sugar is present, and since they are resistant to these antibiotics, so this bacteria will grow. Why not McConkey agar? If you know, it is for the gram negative enterobacteria like E. coli and Salmonella. Okay na? So it is for E. coli and Salmonella. Why not TCBS? TCBS is why not TCBS means thiosulfate citrate bile salt sucrose agar, because it is specific for Vibrio cholera. Okay na? Next is why not Levenstein Johansen media or LG media? It is for the TB. Okay na? So that is why this is correct answer is CCFA, because it contains antibiotic and this bacteria is resistant to antibiotics, so it will grow, or they will allow it to grow. So this is the correct answer. Next question is saying, which of the following organism causes disease by decreasing the protein synthesis? These are all the options. So diphtheria, Vibrio cholera, EHEC, and exotoxin A of Pseudomonas etc, and Shiga toxin. So I will give you a full list of organism of their mechanism of action. So most of the toxin which are having A and B part, A part is for the action and B part is mostly for the binding or ATP ribosylation. So we have list of bacteria which will work by inhibiting protein synthesis. Okay na? So how they can inhibit? Either they can inhibit elongation factor 2 or either they can inhibit 60S ribosome. Okay na? So who are inhibiting elongation factor 2? One is Clostridium or Corynebacterium diphtheria. Second one is exotoxin A of Pseudomonas. It will work by inhibiting elongation factor 2. Who is inhibiting 60S ribosome? So first is Shiga toxin. Okay, Shiga toxin of Shigella. Second one is Shiga like toxin or Verotoxin of EHEC. Okay na? Enterogenic hemorrhagic E. coli. Okay na? Mainly which strain? O157H7, which is causing HUS. Okay na? So these are all which are work by inhibiting protein synthesis. So since it is asking protein synthesis, so diphtheria yes, EHEC yes, Pseudomonas yes, and Shiga toxin means Shigella yes. So answer will be 1, 3, 4 and 6. So A will be the answer. Okay now what are the other? So the bacteria which are working by increasing the cyclic AMP level. So first is cholera. Okay na? I told you cholera is work onto the GM1, bind onto the GM1 receptor. By the retrograde endocytosis it will bind to the GS receptor, increases the cyclic AMP, which will open the CFTR channel. Second is anthrax, which will also work by increasing the level of cyclic AMP. Then enterotoxigenic enterocoli, especially which type of toxin? The toxin is levile toxin. Okay na? And other than this, pertussis will also work by this mechanism, and Bacillus cereus diarrheal or heat levile toxin. Okay na? So these all work by increasing the level of cyclic AMP. Third is which organisms are work by increasing the level of cyclic GMP. So stable toxin of ETEC and emetic form or heat stable toxin of Bacillus cereus. Okay na? Food poisoning one. They will work by increasing the level of cyclic GMP. Then which bacteria or which organism are working by inhibiting the release of neurotransmitter? Okay na? So this is our tetanus, Clostridium tetani. And what are the bacteria which will work as a super antigens? It will be Staph aureus and it will be Streptococcus pyogenes, which can cause toxic shock syndrome. So these are the mostly mechanism of the organism which will work by either decreasing the protein synthesis, increasing cyclic AMP, increasing cyclic GMP, or they will affect the neurotransmitter release. So last question in microbiology was which of the following, or in the given life cycle, which of the following organism is getting transmitted? Okay na? So in this case, I think some options are missing here. So A option was Tina solium. Okay, in the exam it was there, but in the PPT I think missed. So Ebola virus. B option was Ebola virus. C option was Nipah virus, and D option is echinogranulosis. Okay na? So if you want to remember life cycle of all these, so if you see this picture, in this picture you can see that the correct answer is Nipah virus. Why I am saying Nipah virus? Because you can see a bat. Okay na? So this is a fruit eating bat. Okay, and if anyone who is drinking these palm juices, if they will drink or they will eat those infected one, they will get Nipah virus, and they have intermediate host as a pig, okay na, or even pig will eat this, then person will eat those pork, then they will also get infected. So if you have pig and bat, then the most probable answer will be our Nipah virus, okay na. Why not Echinococcus granulosus? Because they have intermediate host as a dog. Why not Taenia solium? Taenia solium, yes, it is transmitted by pig, but it have no role of bat, okay na. If you will eat raw raw pig, then you will get infected with uh, Taenia solium. If you know Taenia saginata is because of beef, or I can say eating raw cow meat. Most probable answer here is Nipah virus. Okay, na? So for Nipah virus, you need to remember it is transmitted by fruit bat. Okay, na? So bat's urine, contaminated food or water, if you will eat, then also you will have infection, or eating raw pig also, and any patient secretion can also, if affected person, will also lead to the infection in transmission. And so this is the end of microbiology discussion, and thank you very much. And if you have any doubt, please do comment. Also, if you like the discussion, please like, share and subscribe to our channel. And thank you very much.